back pain. I get it, makes me miserable most days. Sam, like, hockey must have given you a bad back.
15, 20 years of international hockey.
It's very, very, very common. It's a problem of being human because we walk on two legs. Our spines have to do a huge amount of work. There aren't very many animals that walk around on two legs exclusively. It's like kangaroos, ostriches, and us, pretty much. There's a couple of lizards and some rodents, but basically the human spine has to bear a huge amount of weight. And so back pain comes out of that. Let me talk you through where it comes from, because I think when you've got it, you just feel like the whole thing's collapsing. It's actually quite a specific problem. So your back, I've got two models here, so I mustn't get muddled up. This is a small model of this bit of the back. And what you can see if I pull it apart here is that your backbone, which supports you and protects your spinal cord, this yellow bit here, is separated by intervertebral discs of spongy cartilage. And that cartilage is what gives the backbone its flexibility, but when it's bearing weight, particularly in the lower back, it can bulge out. And you can see this sort of wine gum bit bulging out here. That's a bit of the disc that's bulged out, a bit like a bicycle tyre that hasn't been well fitted. Now that causes several problems. First of all, it can get red and angry and cause inflammation. It's inflamed itself and that's painful. The second thing is it can push on a nerve. There's a nerve root coming out here. And so when it pushes on the nerve, it can give you pain shooting down that nerve and give you the feeling of pain in your legs, other bits of your body. And then it can inflame the muscles in your back. Your muscles kind of go into spasm to protect your back, and that's also very painful. So you've got disc pain, you've got nerve pain, and you've got muscle pain all going on together, which is why it's so intense and uncomfortable.
But not all back pain is going to be coming from that specific thing.
Well, it's often lower back pain, and so it's worth saying, if you've got this is very common, but you can have some warning signs. So it's not always caused by exactly that. So if you've had it going on for more than 4 weeks, if you've got loss of functional weakness in any part of your body, if you're losing bladder control, you're having difficulty urinating, if it's worse at night, if it's been going on for a while, do go and talk to your doctor. And talk to your doctor anyway. So back pain in itself is a legitimate medical problem.
Okay, so if we do have back pain, is there anything we can do at home to help us?
Okay, so the first thing, there are lots of things that so the first thing is mobilizing is good, right? Exercising, keeping it moving. Bed rest is not good. So staying in bed, you might want to, but actually there's tons of evidence that bed rest isn't good. It's what we used to say, but it isn't good anymore. Stay active. Take anti-inflammatory medicine like ibuprofen. Big trials now of paracetamol say that paracetamol does not work for back pain, which is frustrating because you think it should work, but it doesn't. Heat and ice alternating can reduce inflammation, improve blood flow. So those things can be really valuable.
Okay. Lauren's going to show us some exercises.
Lauren is
with your guidance, Sam.
Lauren, that's brilliant. Get down here. So when I say movement and exercise, the first, so Lauren, can you start? Lauren's going to grab both her knees and pull them towards her chest. Now the first thing you see is Lauren gets down on the floor and it's a whole load of hassle, and if your back isn't feeling good, and not everyone can pull their knees up to their chest like Lauren. That's brilliant, Lauren. So but that's limbering up the back and stretching it. Next thing is Lauren's going to do a thing called child's pose. Again, like opening up the back, stretching it. That's really nice. And that should feel good if you've got a bit of back pain. I know, Sam, you talk about good cat, naughty cat, good cat. Is that right? That kind of cranking your back around.
Lots of back mobility. I think having 2 C-sections and, like you say, international years and years of hockey, it's about being strong for me. So if I've got weak glutes.
And both you and Geffen, no one could say Lauren, can you do the side-to-side knee twists as well? I mean, you and Geffen are models in terms of looking after your physical health. And so look at Lauren here. She's twisting her spine, opening it up, increasing that flexibility. This is good to do, but they're not perfect cures, right? And they won't work for everyone. Go on the NHS website and have a look at the range of exercises you can do. But what you're trying to do is stretch those muscles.